This is One-on-One. Dr. Jacqueline Brunetti, Medical Director, Department of Radiology, Holy Name Medical Center. Good to see you, Doctor.
How are you? Good afternoon.
Let's talk prostate cancer. How common is it and how treatable?
That's an interesting topic. Specifically for you as a man,
yeah.
I think that in the last few years, it's about the third most frequent diagnosed cancer of all cancers. The issue is recently, as you must have read or heard on the radio or television, there's a lot of controversy as to overdiagnosis and overtreatment. And in the 1980s, when PSA screening started, there was a huge upsweep.
Everybody's got to get screened, right?
Yes, upsweep in the number of diagnoses. And what the argument is that we're overdiagnosing the cancers. We don't need to be doing this, so we shouldn't be screening people, and that's very wrong. The reason there's actually been an improved survival with prostate cancer is that because of screening, we're diagnosing cancers earlier.
What happens when you, Doctor, when you diagnose and detect prostate cancer earlier? What impact does it have on prognosis and outcome?
Well, you always want to diagnose early, because early means it's confined to the organ, there's no evidence of spread, and treatment is much more effective. The issue, though, with prostate cancer is that it's becoming more apparent that there are indolent cancers and there are aggressive
indolent
cancers.
Meaning?
Indolent meaning low grade, slow growing, tendency not to metastasize.
Right.
So the key is to have a way of identifying who needs to be treated and who can sit back and say, okay, you have this low-grade localized tumor, let's watch it. If you think of breast cancer and the history of how breast cancer was treated and diagnosed, early on, they would remove the entire breast for any type of cancer. Now we're at a stage where you can do mammography, you can do ultrasound, you can do MRIs, and identify very localized disease and localize treatment.
But go back to the prostate cancer screening. Is it 40? Is it 50? What is it?
The American Urologic Association, I believe, says 55 to 69.
What do you say?
I say probably 40. And
Really?
the reason being is because our diet is terrible. It's very inflammatory. It is probably one of the etiologies of the development of cancers. I think it's always better to know earlier.
And by the way, let's clear it up. We are talking men.
Men.
Okay. So, and by the way, what is the prostate?
Prostate is a small gland about the size of a walnut that sits at the base of the urinary bladder, the urethra, the tube that comes out of the bladder that goes into the penis that drains the urine. The prostate creates fluids that help with that go into what's called ejaculatory ducts. So it's sort of a fluid that carries the sperm.
Can you feel, because one of the things in terms of self-diagnosis, we're trying to, as women, learn to, I'm always sitting there going, okay, let me see if I can feel this. You can't, because I go to my urologist, she's like, what are you doing? You're not going to feel that.
No, you can't feel that.
I thought I could. You can't.
You can't.
You've got to get the test.
You have to have the test. And I think that if you have the family history, you might want to be screened earlier. If you're worried about it, you might want to be screened earlier. The problem, though, is that the PSA test alone is not accurate enough to really tell you if you have cancer.
Well, let's talk about what is accurate. This multi-parametric MRI. I know what an MRI is. I don't know what a multi-parametric MRI is. What makes that? That's a form of radiation, no?
No. The beauty of MRI is that it is not radiation at all.
I'm sorry, I apologize about that. That's not. What is a multi-parametric MRI and why is that so important?
All right, what that really speaks to is a method or a protocol of how to do the MRI exam. And we look at the anatomy of the gland, and we also give a contrast agent called gadolinium. It's injected in a vein, and it shows the flow of contrast in and out of the gland.
How good is the picture?
Pictures are beautiful, outstanding. And then we look at one other thing, which is called the diffusion weighted sequence, which is a sort of a measure of density, gland density. So tumors tend to be hard and with little spaces in between, and then are differentiated from the rest of the gland, which has a lot of.
Is this about the best picture you're going to get of the prostate and the best diagnosis?
Right now, this is the state-of-the-art method of looking at the prostate
2 minutes
gland.
left. Let's talk treatment. Because radiation, this is where I want to get right. There are different forms of radiation. Radioactive seeds.
I believe that the data, and I am not a urologist, but the data shows that most methods are pretty similar in effectiveness. And I think that when a patient has a diagnosis of prostate cancer, it's important for them to know, number one, what is their Gleason score? Is this an aggressive?
Gleason score.
And the Gleason score is a measure of aggressiveness of tumor. Typically, a Gleason of 7 or higher means a more aggressive tumor. The other question a patient should ask is the tumor confined to the gland? The way to know that is by having the multiparametric MRI exam. And then beyond that, what is your PSA level? How old are you?
Right.
What's your life expectancy? Do you have other illnesses that would affect that?
And finally, doctor, that is why you are so big on lifestyle, on diet, on exercise.
Absolutely.
Talk about that.
So I did an integrative medicine fellowship actually with Andrew Weil's group at University of Arizona. So I am very tuned to diet and exercise, and particularly an anti-inflammatory diet for helping ward off or at least help prevent some of these degenerative diseases.
We can reduce the odds?
I believe we can reduce the odds. I am convinced that we can reduce the odds by really looking at what we put into our bodies, how much activity we get, and how we can control stress in our lives.
We can't guarantee anything, but we can help ourselves.
I believe so.
Doctor, I want to thank you for joining us. I appreciate it. Dr. Jacqueline Brunetti from Holy Name Medical Center. Important information for us men who have to take care of ourselves, for our women.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Activists in cooperation with the American Medicine Chest Challenge, Choose New Jersey, NJIT, Health Republic Insurance of New Jersey, the New Jersey Education Association, Berkeley College, and by the Healthcare Foundation of New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.